The COVID-19 coronavirus spread in China, its economic impact is being felt in East African markets. They've cut off from their Chinese suppliers. VOA Swahili reporters Idi Wesu and Huba Abdi filed this report, narrated by Scott Stearns.
Commerce between China and East African markets has grown steadily over the last few years, with both bulk and small-scale traders importing lower-cost Chinese goods. But the outbreak of the coronavirus and the suspension of East African flights to China means fewer Chinese goods to sell. Alida Wanjiro is a second-hand clothes dealer in Nairobi.
Coronavirus has greatly affected our business. I used to travel every 2 months to bring goods from China, but now we have been told not to travel and wait until further instructions. It's affecting us a lot. Customers come and fail to get what they want. On the other hand, we have to pay bills.
It's the same story in Tanzania, where business owners in Dar es Salaam's Kariakoo market say they're running out of merchandise from China. Andrea Richard is a used shoe seller.
It has affected us a lot. We could get goods to sell from China every 2 months. It's impossible to do that right now because we cannot travel to China. We have no option but to follow measures in place by authorities to avoid the spread of the coronavirus. We have to wait until they allow us to travel.
Samora Machel is managing director of the Kenyan Chamber of Commerce.
The first group of people to directly feel this pain are small-scale traders, especially youths like those in Majengo Market, Kongowe Market, whose retail goods are imported from China weekly. They will not survive.
With Kenya Airways and Air Tanzania suspending flights to China because of the virus, East African tourism officials are hoping the disruption in air traffic does not undercut regional tourism revenues, as it is already being felt in local markets. Scott Stearns, VOA News, for Idu Weso and Huba Abdi in Dar es Salaam and Nairobi.
The Bill and Melinda Gates Foundation has announced that the foundation will provide up to $100 million to the 2019 coronavirus response in Africa and South Asia. Africa 54 health correspondent Lino Mudu spoke with Mark Suzman, CEO of the Bill and Melinda Gates Foundation, to find out, among other things, how the funds will be dispersed to fight the outbreak in Africa and China.
Well, it clearly is a very major global health crisis. We still don't fully know the scope and range. Obviously, the numbers are very frightening, and that's why we at the Bill and Melinda Gates Foundation have taken it very, very seriously and have committed up to $100 million to help with the response to the challenge, both in China, which is the epicenter, and in sub-Saharan Africa, which does not yet have any proven cases, but is particularly at risk, and in research and development to try and support both treatment and cure.
Talk to us about how the funds will be disbursed and to what extent are priorities similar or different in Africa versus Asia?
Well, in Asia, the epidemic is already a full-blown epidemic. And so in Asia, and certainly in China, which is where the focus of our work has been, there needs to be, or there is already intense focus on, can you provide, the right equipment and supplies to frontline workers who, in many cases, certainly close to the epicenter, being rapidly overwhelmed? Can we help sort of support with private companies, with the World Health Organization and others, the accelerated search for treatments and ultimately a vaccine? In Africa, it's more about, helping put in place, which has actually been happening rapidly over the last week, including with some of our resources, a sort of network, and we've been supporting, for example, a group called the African Field Epidemiology Network, which works in collaboration with the Africa Centers for Disease Control and Prevention to both provide and equip countries with the proper diagnostics and testing, and to put in place emergency operation plans for, if and when the coronavirus is detected and proven on the continent, that countries will be able to respond rapidly and try to prevent any further transmission so we don't see a replication of what's happened in China.
Now, part of the funding will be allocated in research and development. Developing vaccines and cures can take time. What are the prospects that we may see a vaccine or a treatment for coronavirus?
You're right. Global health science and research and development is difficult and tricky. We're moving on a very accelerated timeline. And you look at different interventions at each step. So getting to a full vaccine will likely take a little longer, but there are already multiple potential treatments, including quite innovative treatments, being looked at and being tested in real time, mostly in China. And again, there are these sort of early preventative steps. So when we talk about the research and development, it's about the full range of research and development. It's not just that the vaccine obviously is what we want to end up with, because vaccines are the most effective public health interventions. They prevent outbreaks completely when they're fully successful. But in this case, our R&D and the work we're doing with that organization, I talked to you about the Coalition for Endemic Preparedness Innovations, is looking for gaps and trying to incentivize product development, whether it's in the biotechnology space, whether it's pharmaceuticals, to provide sort of safe, effective, and widely available products for both treatment and ultimately long-term cure and prevention through a vaccine.
Thanks to our health correspondent, Lino Mudu, for that interview.